Good morning, welcome. This is our first Capital Chat of 2024. For those who don't know me, I'm Brooke Lovelace. I'm the Executive Director of the Iowa DD Council. Thanks for everybody for being here. We've got a great group of folks. Been a lot going on in the last 3 weeks, so we have a lot to talk about today. We're going to start off with some success stories, though, and then talk a little bit about the budget and some bills to watch, and then some next chats, and then leave it open it up for some questions and comments that you guys might have. Again, thanks for being here. I think I'll turn it over now to Carlin.
Good morning, everyone. Carlin Crow. I'm the Public Policy Manager with the DD Council, and of course, my dog is going to bark as soon as I get on. I apologize for that. So I wanted to welcome you today and also tell you about some success stories or just share some experiences from a couple of advocates who were at the Capitol this week. This week on Wednesday was our legislative reception, which was in the afternoon. And before that, we had some of our allies who are part of the group Allies in Advocacy, which is our self-advocate advocacy group, and also some of our youth leadership academy participants come early and spent pretty much the whole day at the Capitol trying to contact their legislators. And also we attended a subcommittee meeting and heard some other groups who were meeting and got in on some other discussions. Our chair of the council, Brady Werger, actually had 2 leadership meetings. One was with the governor and one was with the Speaker of the House, who happens to be his representative. And they were very good meetings. And he was unable to be with us today, but he promises he'll share his experiences at our next Capitol Chat. But wanted to introduce 2 of our advocates who were there that day and wanted to see if they'd share their experiences. Zach Meacham, who is the chair, do we call you the chair, Zach, of Allies in Advocacy?
I don't know that we came up with an official title.
Yeah, title. Well, then I can call you like president, something important. Zach was there for the day and actually was in the meeting with Pat Grassley and Brady Werger because we talked about employment. And Zach also was able to contact his state representative. So Zach, would you mind kind of sharing your experiences? You had some great comments to me at the end of the day, so I wanted to see if you'd be willing to share those those comments with the group too. And thanks for being here.
Yeah, no worries. Yeah, so I started the day, as I generally always do when I go to the Capitol. I've been a disability advocate for the better part of 10 years, so I'm a little cynical. And when I get to the Capitol, usually my cynicism is like maxed out. And going into the meeting with Pat Grassley, having Brady have a great conversation with Pat Grassley, it was a good start to my day because it is a reminder of the power of disability advocates working together in numbers. And that's really where a lot of my hope and faith lies, is I was mostly inspired by the work of a lot of these disability advocates throughout the day, their tenacity, their willingness to be vulnerable and communicate their experience. That was really energizing to me. And later on in the day, I got to meet with my legislator. And, most of these legislators, people come to the Capitol, it's a tourism thing. They come to see where bills are made. So a lot of times the legislators will just come in and be pleasant for a second and try to get a picture and, then get their FaceTime in and get out of the way, move on to the next person. And this person did try to kind of make that happen, almost bulldozed me. I had to stop her and be like, no, wait, I have policy I want to talk to you about. We'll get a picture after. And I was able to have a conversation with her about the importance of the Work Without Worries program in Iowa as a disabled entrepreneur. That's really important to me. And she listened and intends to look into it, or said she does. But then after that was the really inspiring thing for me, which was we went to the Allies in Advocacy event. This was an event that I got to take part in putting on, and we had 3 different disability advocates speak, and legislators came to this event, went out of their way to come see what we had to say, and our speakers were so powerful. And to me, that's again where all of my hope in this process lies, is that when I see advocates working together, sharing their stories, and pushing to make things better, it removes a lot of my cynicism. Because when you listen to somebody like Sarah Young Brown or Brady or Chris talk about their experience, share their successes, but also get vulnerable and share how the system works against them, it's hard to believe that somebody can't be moved by that. And that makes me believe that through our work over time, we can actually make progress. Maybe not tomorrow, but if we keep moving forward, we can keep chipping away at these issues.
Thanks, Zach. That's a really great message that we're better together, right? And it kind of shows on the screen too how many organizations work together to bring messages to our legislators that day. So thank you very much for that. And I want to ask another entrepreneur, Libby Schweers, who is a graphic designer, and some of our she's using some of her talent in to help both in our advocacy efforts and the allies and advocacy group that she's in. So, and Libby was at the Capitol all day on Wednesday too. Libby, would you mind sharing your experiences that day?
Yeah, thank you, Carlin. So Wednesday was my first time being at the Capitol, actually. I'm a little bit newer to the advocacy world. I've been doing things for maybe 6 months to a year now. So it was a really, really good day and an eye-opening experience for me. I mean, especially just being in the Capitol building and seeing how things work. And I thought that was really interesting. But I also learned a lot because we sat in on a subcommittee meeting and we kind of figured out how we can communicate with our legislators. And I didn't really know that you could go to the Capitol and kind of go through the motions. And if they're available that day, you can actually have a meeting with them. So that's really good to know that I can take it upon myself and just go to the Capitol and do that. Well, my senator that I wanted to speak with was not available on Wednesday. However, I happened to run into another senator. Her name is Carrie Kelker, and she is from my hometown of Dyersville, Iowa. So I've known her for a long time, and I've been kind of working with her the past couple of weeks on like disability employment issues. So I felt like it was like fate that we ran into each other and we got a picture, and she knows my senator very well and is really close with him. So she said she was gonna text him and we can arrange a later meeting to talk with him. So even though he wasn't there in a roundabout way, I feel like it was a really productive day, and I learned a lot. And then, yeah, like Zach mentioned, we had our first Allies in Advocacy open house event, and that went super well. We had a great turnout. We had legislators there. The speakers were amazing, and it was moving, and it really like made me feel like I was part of something. And kind of like Zach was saying, like, I think slowly but surely we can definitely make some progress if we just continue to speak up and show up and, not let things go. Like, if we just keep pushing, we will get to where we want to be.
That's great, Libby. Thank you.
Thank
That's
you.
great stories. And both Zach and Libby, as I said, were there to the bitter end. It was a long day that day, and we all hung in there till the end. And they both said at the end of the day, I want to do this again. So success stories all around. Thank you for sharing today with the group about your success, and we hope to hear more.
Yeah.
So I'm going to turn it back to Amy. Well, over to Amy now, who we haven't heard from. And hopefully we're hoping that her voice lasts through this presentation, because I don't want to have to take over, Amy.
Well, yeah, sorry for those of you that, if you can't hear my voice, but it is actually better than it was yesterday, so that's a win. But apparently I've been talking too much at the Capitol, or yelling maybe is the case. But I just wanted to open up. I know we went over this last Capitol chat, but I know we've got a different crew just to level set kind of where we're at in the legislative process. Because it's a short session, we have deadlines about every month. So it's about a month in between each deadline. So the first one actually passed last Friday, when anybody who wanted to sponsor a bill, like have their name on as the sponsor, had to ask for that bill by last Friday. So committee chairs can still ask for bills, but leaders can ask for bills, but your rank and file legislators only had until last Friday. Our next big deadline is coming up here just in a couple weeks. On February 16th is the first, we call it a funnel, because all the bills go into the funnel and fewer come out at the end. You literally have to get past the first hurdle in the process is getting out of committee. So that's the first thing that has to happen. And if you don't make it out of committee, if the bill is stuck in committee on February 16th, it's dead for the rest of the year. So if you see bills you like in our bill tracker, and want to make sure they get through that first hurdle and first funnel, now's the time to talk to your legislators, because they've got to have a subcommittee meeting, pass it out of subcommittee, and then get it before the full committee and vote out. So time's running out. They only work 4 days a week. So there's not a lot of time for subcommittee meetings, to get it all done. Then the next funnel deadline is a month later. And that's a bigger one, where they actually have to pass one chamber and then get out of committee on the other side. So all of this is going to happen in a month, or, in the next 4 months. You can see the final legislative day is April 16th. So hopefully, budget should start in that last month, March to April as well. So it's just a lot of work in a short amount of time. And you'll probably notice as we start to talk about the bills, there's some really big bills that they're going to be considering this year, and not easy bills, probably very long bills. But I wanted to go over the governor's priorities. that she announced. I know that many of you probably have read the written reports, but one of those issues is cutting taxes faster than they had planned. In 2022, the legislature cut income taxes, and that was supposed to ratchet down to about 3.9% flat tax. So everybody would be taxed on income at 3.9%. The governor wants to move a lot faster and make that 3.65% this year and 3.5% next year. And why I bring that up with you is that you can see this line here. Right here, I kind of drew a line. You can see this is 2022 when they passed the income tax cuts, and now it's starting to go down. The blue number is the total revenues we're bringing in to the state. And we've got some balance carryover because we haven't spent a lot of our extra federal funds, and there's money, they've been spending less than what they could each year. So that's been kind of helping us keep our budget pretty stable, but you'll notice that we're losing money. And that's important because when you look at the next page, if you look at what health and human services and education is, that's 83% of the entire budget. 83% of the entire budget. So when you go back to that line and you see, where do you think those cuts are going to have to happen? It's going to be in that bulk of education or health and human services, a large amount of which is Medicaid. If you add in prisons and the courts, that's 92% of the budget. And those are kind of considered things that you can't really not pay for. So there's nowhere else to cut if there's not enough money coming into the state than in education and health and human services. So I just want you to realize that as you're hearing about tax cuts. I think everybody likes tax cuts, but those have real implications for programs and services, especially as we're looking at needing to put a lot of money into home and community-based services and really support that system to meet the concerns that were raised during the Department of Justice review of our state. So that was her first priority. The second one, she wants to expand Medicaid for 12 months following the birth of a child. So right now, women who have are pregnant get coverage for 60 days. Iowa is one of only 3 states that only provides that 60-day coverage. Everyone else, except for Iowa, Idaho, and Arkansas, have gone to a full year of coverage after the birth of a child, which of course you have postpartum depression that might not show up until later. You really get healthier outcomes when you follow that. And so the governor's proposing this. The only problem is the governor is, right now, Iowa is at the highest in the country for eligibility for our program at 380% of the federal poverty level. She wants to move that to 215% of the federal poverty level. We don't really know the impact of that and how many people are going to be in that grouping. My understanding is 215% is the average of all states, but a lot of our borders have 250%. So I don't know if there's some flexibility there or not. And we know that last year they estimated the cost to go without any reduction of eligibility would be about 5 or 6 million. So not a lot of money to cover that, the moms and kids, babies after that. And we know that there are cost savings related to that too. And I think the Department of Health and Human Services is looking at those cost savings as well. There is a bill, House Study Bill 500, but the governor's bill is not out yet. And we understand that's the one that's going to be the lead bill. So they won't move House Study Bill 500. They'll work on the governor's bill when it comes out. The other policy priority she had, and I know we've spent a lot of time in our newsletters on getting rid of the boards and commissions review, and getting rid of boards and commissions at the state level. The recommendation was to reduce boards and commissions by 43%. That is, I believe they retain, let's try to think, 145 and get rid of 111 boards and commissions. So almost half of boards and commissions. But what's important is that to think about, that's a lot fewer opportunities for Iowans with disabilities and Iowans in general to serve on those boards and commissions and be a part of state government. We anticipate it's over 450 people, fewer people being on boards and commissions. So that, is a big piece because the Iowa Developmental Disabilities Council has worked really hard to work with individuals with disabilities to have them apply to be on boards and commissions so that their voices are heard on lots of different boards and commissions, not just ones in the health and human services area or disability area, but the plumbers board and other boards and commissions. There is a recommendation to get rid of gender balance, which I know has been hard sometimes even for the DD Council to balance their boards and their board. But right now, as of 2020, only 61% of boards and commissions were gender balanced, even though we have a requirement. So getting rid of it when we're not even fully gender balanced has some people concerned. And I just wanted to highlight a couple of the ones that are up for elimination: the Advisory Council on Brain Injuries, the Children's Behavioral Health System Board, Mental Health and Disability Services Commission, Congenital and Inherited Disorders Advisory Commission, and the Commission on the Status of Persons with Disabilities. Groups like the Developmental Disabilities Council were not reviewed because they're federally required, so the state doesn't have any authority to do that. One other thing that they're suggesting changes to is the Autism Council, and allowing, if you can't find a child with autism or student with autism to be on the Autism Council, they are allowing, my husband just came to get me more water and he moved my screen. Thank you. Allowing students with other disorders to be on the Autism Council, not necessarily with autism. So I know that has some, concern there. Now I can go on to the other one. The other priority I know a lot of you have looked at is the change of behavioral health districts and how we do those regionally delivered mental health and disability services. They're proposing, and this is a draft, 7 districts, and there would be an organization that is picked to be the lead agency and the lead organization to administer the mental health, substance use, community mental health center block grants, tobacco partnerships, all of those funds. You'll note that disability isn't included in behavioral health districts. They want to move that to the aging and disability side, and be a part of the aging and disability resource centers, but we have not seen a plan on that side. But all of this is supposed to go into effect July 1, 2025. And we don't have a bill yet. So I think there's a lot of concern about the quickness of this as well. And how all of that works and moves when you have an ADRC system that is not really doesn't have any disability in the aging and disability resource centers, is more focused on aging because that's where the resources have come from. There have been no resources for that. So I think there's some trepidation about what that means. And then I wanted to go to special education changes, and I'm going to pop it over to Carlin to talk about this because she's done a lot of work, had a lot of conversations about the changes that are proposed with the area education agencies. I just wanted to note before she starts that we do have a special page on our website there. It's iowadd.org/AEAs, just because special education was longer to write for a URL. So It's AEAs, but it really is about special education. So as we find resources and information, we will put it on that that part of our website.
Thanks, Amy. And yeah, I'm sure that you all have heard about this bill and this legislative proposal and the governor's plans. And also, hopefully, you've heard that because of a lot of pushback, a lot of people expressing their just expressing their voice on what they think about this, that there has been a slowdown of movement on where this legislative proposal might go. And we had a lot of conversations about it on Wednesday with legislators, and maybe have some news to share about that, although it's still very unknown. And we'll come back to that. But in case you don't know all the details of the bill, the the emphasis is on AEAs, and the proposal and the language around it has said they're not getting rid of AEAs. AEAs will still be there, but they're basically dismantling them the way they are now. A lot of the services that AEAs have provided would not be provided by AEAs, and they would all move under the Department of Education. So they would not be independent from the Department of Ed, even though Department of Ed still has oversight right now. But their main oversight is local boards who are the leaders of local AEAs. So the focus, as the governor proposed, would be only on special education, and she's because of pushback has also turned that idea around, although we haven't seen any new changes yet. But a lot of discussion has been kind of like, what does that mean? If it's special education services, or is it teaching? Is it about resources? And so that's where a lot of our education is taking place, and a lot of things also that we're learning from teachers, AEAs, and parents, and the things that AEAs provide for them, and how the school districts and the AEAs work together. There's also some other issues in the bill that may not have so much to do with special education, which is our concern, but just the takeover of the AEAs means that they'll not only lose local control, they'll lose their local property. So that affects your local taxes and what you've already paid for your AEA. That all comes back under the state. The resources that they use for traditional students also would come back to the state. And there's the teacher salary increases were also added to this bill, although they only are for 1 year for salary increases. So that means that school districts then have to figure out how to make those new salaries available, or raise more money, basically, try and find funding for to maintain those salaries. And that's been a big discussion since it was revealed that those teacher salary increases are only for 1 year. So because of all of the pushback from almost everybody, it seems like, on this bill, and there's been a lot of kind of new advocacy groups that have grown out of it. There are a lot of people working together who've never worked together before, including the school boards, the AEAs, and other advocate groups for education are now pulling together to at least stop this proposal the way it is funded now. And our messaging around it is that we were pleased to see that people are talking about special education and how we can make special education better in this state, but that apparently this is not the way to go about it. And we all know that dismantling the AEAs as they are now is not really addressing the problem. So when we are focusing on this bill and trying to educate even legislators who are getting a lot of education from their constituents, which is great, and they say to keep it coming. You know, we were talking about how the AEAs support special education services, that they don't teach special education, they support special education services for students and parents, and they are also advocates for parents and are part of individual education plan meetings, which are how goals and success is measured for students in special education. So we are, trying to keep our focus on that, and also talking about, if this isn't the way that we can make the best changes to special education for our students in our state, giving legislators ideas of what should be the focus. Because we know that there are students who aren't getting the services that they need, and there are schools who are not able to fully fund their special education positions. Even AEAs have said that, but they don't have as many staff as they need to in some rural areas. So, what is needed to bring up the funding that's needed for special education? And we actually talked about this last year in the session, last legislative session, when the educational savings accounts bill went through, that currently special education is not funded at the amount that it needs to be. It's underfunded by about $140 million was what was reported in last session. And that's not being looked at all. In fact, what's being looked at is cuts through the AEAs. So if you're contacting your legislators about this, and they have said they've got hundreds and hundreds of emails about this bill, but to keep them coming, and they want to hear your stories. So focus on your stories, make it as brief as possible, and just come to that point and make a suggestion about what could be better for either yourself or your students that you're working with. And if you have any more questions on this, please feel free to reach out, and we can answer what we know about it, which we think that the bill in its current form is not going to go anywhere. They're working on maybe not even amendments, but rewriting it in one of the chambers. But there are many legislators who do not want to see it go anywhere in the form it is right now. Back to you, Amy.
Sorry, I had to unmute myself. Had to unmute myself. Get this moving here. All right, just to focus over on budget before we go to bills. And we do have a lot here. I'm sorry to throw a lot out all at once, but just we won't concentrate a lot on the budget because that'll come later in the year. But the governor is recommending some additional dollars for Medicaid, although not a lot compared to what you think you might expect with us being under scrutiny by the Department of Justice. There is a little bit of a bump for home and community-based service providers. So 14.6 million. I think they were expecting more closer to 40. And also, especially because inflation is just higher and they can't increase wages enough. And some additional dollars for home health reimbursement. And then also you're going to see $35 million increase for MCOs. That's not actually an increase. Last year we taxed MCOs $35 million, and then we are giving it back to them, but it's going to draw down additional federal funds. And those federal funds, Medicaid keeps. They don't give it to the MCOs. So it's kind of it's a legal scam. It's perfectly allowed, but it just is a way to get more money into the Medicaid budget without appropriating any additional state dollars. So I don't want people to think that's an increase to MCOs because it's really not. I didn't put this in here, but there's also a $5 million increase to help with case management. I believe that goes to the MCOs though. So we'll have to see and watch how that pans out. And as you can see, there's a little bit of extra for voc rehab, but they have a pretty good match rate. I can't remember, is it $1 draws down $3 of federal money? Carolyn, yes, she's nodding yes. So
$3.70.
$3.70. So if you multiply $120,000 by $3.70, you'll get the amount that'll generate for the state. So it's a good amount of money to additional dollars. I also always like to show the graph. You can kind of see we haven't really gained a lot of ground in funding for the HHS budget. It's kind of just hovered around the same amount of money. And other funds are things like tobacco funds and other settlement funds that are there. And so kind of moving on, I'm switching over to some of the bills that we have. We've been watching in the legislature, and I wanted to call attention to two particular sections of our website, the bill tracker, which is where you can find each day we add bills that are introduced, and the bills that are already in the bill tracker have real-time updates on their status. So you will always know where it's at when you open it up in the bill tracker. It should update automatically. And then we have a new feature called Bill of the Week, and that's what you see right here with Representative Chad Ingalls as the sponsor of House File 252, which establishes those comprehensive transitional educational programs. It provides some scholarships for those college-based programs. It's something we're doing on one bill each week. We thought we would actually have a hard time picking the bills and finding ones, but it's been hard to decide which ones we do for each week because we've had so many options to highlight bills. So I guess that's a good problem to have, but we wanted to focus on that one first because we know that's already passed the House and needs Senate action. So we focused our first bill of the week on that. And for those that are interested in that, it's a little bit further along in the process. So it's alive until at least March 15th. I think we also did a snapshot. Our snapshots, our videos are much shorter this year. They've been in the 3 to, I think we hit 7 minutes with the one with talking about the AEAs with Representative Segrist, but they've been hovering around 3 to 5 minutes. So and we're interviewing legislators, so they're a lot more interesting than hearing just Carlin and I talk for a half an hour in them. So I hope you check those out on the website too. But that was our first one. We also did our second one on the AEAs, and this week's is going to be on that. You'll see Senate File 2022 in there. It's Senator Zahn introduced that, and to require prescription information be in an accessible format for those that are blind or visually impaired. Representative Forbes is going to co-sponsor a companion in the House. I haven't seen a bill number on it yet, but we interviewed him for this week's snapshot. So hopefully you can take a look at that. I think that one's a lot shorter because I wasn't involved probably. Carlin did it with my intern. So but there were some other bills I wanted to highlight. Some of those you probably saw in here. House File 2003 allows students with disabilities to participate in school activities and programs and competitions that up to age 19 through age 19. Some kids had students were not allowed to participate after they turned 18 or 19. And so that allows that continuation. House File 2005 allows Medicaid reimbursement for parents who are providing personal care services under the Consumer Choices option. I know many parents we've heard from wanted something like that. there's a review, House File 2009 is a review of state parks and whether they're accessible to people with disabilities. I wish House File 2108 had a chance, but I don't think it does. It eliminates waiver waiting lists. I think with the review that's going on right now with the waiver reforms, that probably won't move forward. Paula, I will get to you in a second and just go through the last couple here, and then we'll move to you. And then there's also, Carlin, do you want to talk about House Study Bill 591? I wasn't in that subcommittee on the pilot program that the Secretary of State's office is suggesting we look at to allow visually impaired or individuals to vote privately by absentee.
Yeah, so the bill proposes, as Amy said, that there can be absentee voting by mail for people with disabilities, and particularly those who are visually impaired, which is a great step to helping improve accessibility for people who might have difficulty getting to a polling place, or when they get to the polling place, they are not serviced as they need to be, because sometimes people who are running the polling places don't know how to use the accessible equipment, and that's one of the reasons for this also. So it's allowing absentee voting by mail, but it's by paper. So one of the concerns, one of the reasons that our advocates who might be blind or visually impaired are not completely in favor of this is because it still does not allow them to have private, independent way to vote. They have to use a piece of paper to mark their vote and then send it back in. So they would like for it to be completely electronic, and the state just is not quite there yet with the ability to do that. So they're looking into it, but at this point, the pilot program would launch this as a first step into helping making voting by absentee more accessible.
Thanks, Carlin. I also wanted to highlight two other. Senate File 2045 is the Work Without Worry bill on the Senate side. I think there's going to be, we still have the ones left over from last year, but it allows you to work to your full earning potential without risking loss of the services. We are going to cover that in a future bill of the week. So stay tuned on that. But it is something that is starting to get bipartisan support. And I think the Health and Human Services Department is looking into it as well. So, oops, I don't know what I just did. I just jumped way ahead, didn't I? And then also you can see Senate File 2066 would allow us to make the special ed teacher, lead special ed teacher, not a coach or an athletic director, the person that determines whether a student with a disability can play a school sport. And so I'm going to ask Paula. Paula, do you want to unmute? You had a question?
Yeah, it's about House File 2005. We've already amended our state plan, waiver plan, to allow people, it's a pretty good definition, parents, spouses, and other legal representatives to be reimbursed for CCO. I mean, it is in the works. They are waiting for CMS. The reason I know this is I did a lot of consulting in 3 states who wanted to try and pass this legislation, and I'm just going to tell you, those got really ugly, and we did not end up with the bills we wanted. I know we're limited on time, but I'm just going to share that there were allegations made that if we let parents pay, all these dire things were going to happen, and they did restrictions such as you can't do it if you had more than one child in the home, because how could you be providing services? So from my perspective, I'm not sure that we want to go down that road, especially since it's already been amended. It was done, the states had the option once the K amendments went away, and we're just waiting on CMS approval. So just a caution, that concerns me a little bit.
Thanks, Paula. Carolyn, can you answer Pam's question about the up to age 20? I know we had a conversation about 21 versus 20. On the services in the school. I think it's because Iowa schools interpret it as until you turn 21, even though it says through 21.
I think the bill is not about who gets services till what age. It's only about if they can participate in sports or not. I know what you're asking, Pam. But this was about sports, and I don't know why, but for some reason they can only participate in sports up until age 20, and I think this was not that rule was not about kids who are in special education or who might be going, past graduation up to age 21 in school. So anyway, the bill is just about athletics and who can participate and giving them an option. But yeah, the whole 20 to 21, actually in federal law, it's 22. And so we're kind of making it 21 in a very interesting way.
Yeah, and the second part of your question about Jeff Taylor is the chair of the Senate Education Budget Subcommittee, and Ken Rosenboom is the Senate Education Committee. But on the previous page, it was Jeff Taylor is the chair of the subcommittee on Senate File 252. Sorry if that was confusing. He's chairing that subcommittee on Senate File 252, or House File 252, which is the Transition Scholarship Program. So that's why he was listed as chair, because he's chair of the subcommittee on that bill. But he is chair of the education budget, and Ken Rosenboom is chair of Senate Education. And it's probably a good time to note, there were a couple changes in the Senate on committee memberships, and we updated our online legislative guide with those. And the last issue of InfoNet, we included what those changes were. So if you go on the website, look at the newsletter, there you can see if the changes. It was mainly spurred by Zach Walls no longer being the minority leader. So usually the minority leader doesn't have a lot of committee assignments. So they kind of took some away. It kind of rebalanced that. So Pam Yoakum didn't have as many, and Zach Walls got some. So, but there were other changes too, like some Republicans made some switches too. So I'm going to just move on here. That might be it. We do have a few minutes if anybody wants to talk about some other bills before I just wrap with what we've got. 10 minutes if people have other questions. Oh, thank you, Bridget. Sorry. I did get some information on the athletic eligibility. So it just has to do with athletic eligibility requirements. So that's why the ages were different. So Pam, I can get you more information on that. Hi, Kay, go ahead.
Hi. I don't have a question, so if anybody else has questions, I just have a comment about the event the other night at the museum, the historical buildings. And these thoughts came to me when Zach was talking at the very beginning of the meeting. So if there's other questions, let me hold back. But
I'm not seeing anything, Kay, go ahead.
okay. Well, when Zach said he's a cynic, after being an advocate for 10 years, I've been doing this for 40 years, and I have become a real cynic. Maybe primarily because the Home and Community-Based Waiver Program was established some 40 years ago as a demonstration project. And a whole generation has grown up, and we still have waiting lists. And even people that are on waiver services can't get the staff they need. Staff's unreliable. Y'all know all the issues we have. But I have to say, hearing Zach, hearing Brady, hearing Chris, and the other ladies did give me some hope, because their voices are so powerful. I mean, I've been advocating for my son and other people with disabilities. My son just simply does not have the expressive language to really discuss policy. His power is just in his living his life, living his best life, and letting legislators and policymakers see that. But I just wanted to say the Allies in Advocacy does kind of suppress my cynicism, because I just feel like, the elected officials at the federal level and the state level, they have not had as a priority. Those waiver programs were established as demonstration projects, as an alternative to institutional care. They have demonstrated for decades now that they provide a better quality of life in a more cost-effective way. But here we are. But I do think that people like Zach and others can maybe bring us forward, so that the next generation of people don't sit on waiting lists, and when they do get a waiver slot, they can get the services they really need. Thank you. And thanks for the DD Council for everything you do. I love the DD Council.
Thanks, Kay. I feel the same way. I feel like I'm an eternal optimist, but it's easy to get beat down. But I love seeing younger people taking up the charge with their energy. It's really good to see. And it's also kind of gives you hope too, like you were saying, that all right, maybe I can maybe I can do this another year or whatever. But yeah, I think the DD Council providing these opportunities is fantastic too, for people to get involved and get more. And I think you saw that from legislators. They're interested, and you're starting to see more bills, whether you like them or not, or whether they're perfect or not, trying to get at some of the workforce issues and other things. So just government moves very, very slowly.
And too slowly. I'll just say my mantra now is we'll see. We'll see.
Yeah.
Well, and I know this is really hard, but we also have to be aware that we're pressing our congressional delegation, because there's actually 2 bills currently in front of the Congress that would give states more money to address waiting lists. And I know the letters I got back from our congressional delegation on the issue are more than disappointing. And in 2 cases, I would say they didn't even understand the issue. And I know it's a lot, we got so much going on in the state. It's hard to keep track of what's going on federally as well. But Senator Bob Casey's bill to increase home and community-based service programs and give more money to the states is one of those important pieces of legislation. And I don't know how you'd get rid of wait lists without some support from the federal dollar and state match.
Thanks. All right, we probably got time. We got 4 minutes for one last question. You can see on the screen our next capital chats for sticking with the kind of the last Friday of the month for each. And you can register for all of those now. They're all up and live on that link. But any last thoughts or comments, questions?
Amy, we do have Brady on too, if we want to have him give his.
Yeah, I'm guessing he's going to be longer than 4 minutes. 3
Brady,
minutes.
do you need more than 4 minutes, Brady?
3.
Just brief talk here. I can shorten it here. Hello everybody. I'm Brady Werger, chair for the Iowa Developmental Disabilities Council. On Wednesday, I was able to have a one-to-one meeting for about an hour with Governor Reynolds. It went really well. I did talk about the waiting list. The waiting list. I talked about employment and how it's important to me to be employed within the community. And caregiver shortage was another topic I brought up with her. A topic about education I brought up too for people with disabilities, which kind of popped in my mind, was we have places like Job Corps or Carlin, I can't remember what program your son's in at the University of Iowa, but right now they cut it at a certain age limit. And so being able to expand the age limit for vocational trainings through Job Corps or the Iowa, is it Iowa Reach or Iowa Lend, Carlin, being able to expand those ages to allow young adults or even older adults that want to do a vocational trade that they're able to. And I had full support from Governor Reynolds that needs to be relooked at, and we need to start providing more opportunities for people if they want to go into a vocational type setting. So my visit with Governor Reynolds went really well. I felt like she really took it in deep and really focused on, the concerns that I have. So my goals here are to continue to talk with her this year, and keep pushing to move things forward in the best positive way we can do it. But I also, if there's any legislators on here today, I just want to let you guys know we can't do this without your support. So if any of the legislators have any ideas of how we can work on caregiver shortage or waiting list, please reach out to the DD Council. We'd love to hear your ideas and what you can do to help us make change better for people in Iowa struggling with their disabilities. So I will just kind of leave it at that. And if anybody has any more questions, I can talk to them later or contact the DD Council and they can get you in touch with me and we can talk further about that. Thank you guys.
Thanks, Brady, for joining us. And I know you have a lot of other things to share too. Maybe we can do that also next time if you're available as well, because you are the only guy I know to be able to walk in and talk to the governor. So
yep,
it's a pretty good position to be in, and Speaker of the House. So
well, and I was late today. It is final. I am moving February 6th into my own apartment. So living a lot of years in ICF facilities, this is just it almost puts me in tears because I've come so far, and we need to continue to hear those positive success stories because they're not always heard. So
Yes. Congrats, Brady.
thank you.
All right, everyone. Well, thank you very much for joining us. We really do appreciate it, and for your questions and thoughts. Let us know if anything more, and we should have everything posted on our website, some of the new stuff here pretty quickly, at least by Monday. So you'll check them out. Thanks.
Bye, everyone. Thanks.
Have a great weekend, everyone. Thank you. Thanks, Donna.